Hi people, today
Hi.
my guest is Sven. Hi Sven,
Hello.
welcome to our series of business videos. So can you first of all introduce yourself?
Hi, I'm Sven. I'm a medical doctor by training, have a background in public health and another in public policy. And after a couple of years in the hospital, I went on to become the chief medical officer of a company called Smart Helios, which aims to provide patients mostly, but also their relatives in a way, with technologies that help them to stay healthier longer and have more control over the situation.
Nice. Yeah. So Sven, I know that you are in a startup, you work in a startup, and I was always actually wondering how challenging is it to start the startup in the healthcare field?
Yes, good point. I think a lot of people underestimate it because you might be really good at one thing, you might be very good techie and I don't know, very good at writing algorithms or whatnot. But in healthcare, it's highly regulated, so you might have to have a quality management system that needs to be approved, which is already very expensive, do post-market surveillance, do clinical trials possibly, know a lot about how medicine works, sort of not just from a cultural perspective, but all the rules of evidence-based healthcare. So it might mean that your founding team has to be much bigger. You have to hire a lot of people right from the start, which is an entry barrier.
Okay, cool. Another actually point that's I also wonder, and a lot of people I know in the, let's say, IT industry, they are questioning, which is this technology adoption in the healthcare field. We see, the adoption is low in the healthcare field compared, let's say, to logistics, to finance, to other fields. What's your comments on it? Why is it the case?
So I asked myself that question a lot too when I was in working in the emergency room and so on, and I kind of start to understand it now. So one reason is that a lot of the mantras that apply elsewhere are not really easily applicable to healthcare, and one of it is the fail fast, fail early, fail often kind of thing, which to a doctor often sounds like, oh, you want to kill fast, kill early, kill often? Is that what you're saying? Yeah. So we have a lot of risks to actual lives, and so we become a bit risk averse, and the price of that, I think, is sluggish innovation. Another reason also is, anything around data protection. It seems that people, for good reasons, are much more careful when it comes to putting health data online than sharing pictures of your cats or whatnot.
Yeah. Well, I see technology can also save lives, but you have actually to show it to people.
Sure.
So let's say the adoption for some reason increases or becomes more compared to now. Where do you see technology can add a value in the healthcare field?
There are several fields, and I think you have to look at sort of what's the short-term, mid-term, long-term realistic goal. For the short term, I see a lot of scope for intelligent automation that could take away the logistics of getting to collect all the data of patients. When I worked for 8-9 hours in a hospital, I spent easily 2 to 3 hours making phone calls to have people fax me reports about the patients, which is absurd because the patients are just standing there and they wonder, where is everybody? And the truth is I'm waiting for a fax that I'm just going to manually type in. And another thing is it gets more interesting, I think, is all this stuff around clinical decision support. So it could tell you, with this disease and these medications, you're most likely to help the patient by doing this. And for the patients, the same thing. So they could become much better informed because they know what their reference population benefited from the most, and so on.
Okay, let's say, apart from let's say these straightforward, scenarios, where do you see technology can actually change deeply how healthcare works?
Oh, that's a good one.
Yeah.
I think we always think about, okay, so how can there be some incremental change, improving efficiency, finding more diagnoses, being better at prevention. That's great. There's a lot to be gained from. I also think that technology is going to enable us to shift our mindset in the future, and that's for me one of the most dramatic changes. At the moment, if you have a knee problem, you go to the surgeon, they take some pictures, x-rays, CT, whatnot, and then they would say, okay, we can operate you. They might be doing it, and then probably the operation goes really well, but the question of does it add value to your life has not really been answered. Maybe if you're a gardener, you don't want a knee operation because then you can't bend your knee so well anymore, but these questions aren't being asked. Now, if we have technologies where we can ask very personalized questions about quality of life, about what matters to you personally as an
Yeah.
individual, and we can feed that back using intelligent analytics and all these new emerging technologies. We can become much better at incentivizing doctors towards looking at the best health outcomes, at finding the people who treat best, that's called positive deviance, or at informing patients around things that are really outcome based. And that I think is going to be a massive game changer, because in many times it could mean that the surgeon gets better outcomes if they don't operate.
Okay. Yeah, that sounds really interesting. Let's say, like in few words, how do you
Right.
imagine the hospital of the future?
Oh. I'm not sure if there will be hospitals, at least not the way we know them.
Okay.
I think we will have a change in the center of gravity away from the hospital into the periphery, maybe more hospital at home, like Johns Hopkins pioneered it many, many years ago already. And maybe more solution shops that are more focused on treating one problem rather than being this one size fits none, we can do it all kind of shop,
Okay.
which is extremely inefficient.
Okay. Cool. Yeah. Then thanks a lot. It was
Thank you.
really a pleasure. It was
Yes.
insightful. And guys, if you have like more comments, you can just write them like down. Thanks a lot, Sven.
Bye.
Thank you.
you.
Bye.